key message here is that there is no safe level of alcohol consumption. The more you drink and the higher number of years that you drink, the higher your risk. And I suppose conversely, the positive side of that message is the less you drink, the lower your risk.
Welcome to our HSE Talking Health and Wellbeing podcast. Today we're going to dive into the latest developments in public health and explore the impact of alcohol in our society, our health and our future. We're focusing on alcohol harm, but especially on alcohol and cancer. And we're also going to talk about the groundbreaking new alcohol labelling laws set to be introduced in Ireland in 2026. I'm really grateful to be joined by Dr. Breeda Neville, who's a specialist for public health and works in the National Cancer Control Programme, and also Sheila Gilheany, CEO of Alcohol Action Ireland. So you're very welcome, ladies, and thank you so much for joining us. The first question I was going to ask you, Sheila, was about the labelling laws. How do our labelling laws compare to other countries? I know there's a new labelling law coming in, so maybe we'll just talk about that a little bit first.
Sure. So we have a labelling law which is due to come into effect from May 2026. It'll give clear-cut information. It'll give a warning about not drinking in pregnancy, about the links between alcohol and fatal cancers, and that alcohol causes liver disease. But as well as that, give some more basic information about how much alcohol is in the container that you might be buying, and also the calorie value, so the energy value that's there. And a great thing, I think, as well, is there's a link to HSE website, Ask About Alcohol, so that, the potential consumer can get much, much more information than just what you would see there. So that's in a nutshell what's on the labels. Compared with other countries, it's very comprehensive. I think Ireland should be proud of what it is achieving in that, because other countries have bits and pieces maybe of that. So you will see pregnancy warnings in some countries. France, for example, would have that. Some countries would have warnings about not drinking and driving. And others have kind of vague sorts of warnings. Things like may cause illness, or excessive amounts might lead to this or that or the other. This is comprehensive. This is giving detailed factual information. And it is a world first in the scope of what it's doing.
Okay, so is the label going to take over the whole bottle, like the images that we see on cigarette packets? Or?
No, it is a text-based label, so different from the cigarette packages where you see images that are used there. It is laid out in law exactly, the size of it. It certainly isn't taking up the whole of the package or anything remotely like that. The regulations that give effect to, the size of that, they were published back in 2022. It had to go through, had to be notified to the European Commission and also to the World Trade Organization. So there were processes that had to be gone through to get it there. But essentially what they did was they give effect to a law that was passed in 2018. And it was on the basis of what was passed in 2018 as to what, in fact, the label would look like.
Okay, and it'll be on every bottle, can of alcohol?
Every product that you might buy, but it'll also be on posters that'll be up in licensed premises like pubs, for example. And another very interesting thing about it is that that same legislation allows basically for controls on the content of alcohol advertisements that we would, for example, see on TV. And when that piece of the legislation is commenced, every alcohol advertisement you would see will essentially have to carry the same warning, the same messages, within that. So they're kind of designed to work together as a package. It's not just about seeing it on the can that somebody might buy. It's about seeing it in a wider context as well.
Okay, and Breeda, you're a public health doctor, so how do you think this will impact, or how significant do you think this change would be? Because if the warnings are around cancer, and there's going to be clear health warnings, do you think this will have an impact on public health?
Yeah, so I think it'll be hugely beneficial. So crucially, it'll empower people to make informed decisions about their health. But also, in order to reduce alcohol-related harm, not only do we need to arm people with this information about the harms of alcohol, but we also need to introduce harm reduction policies. And in order to introduce these policies, you need to have public support. And we know the evidence has shown us that increased awareness amongst the public results in increasing support for these harm reduction measures.
And one of the things about alcohol and cancer, do you think that people know that alcohol causes cancer? People know that cigarettes cause cancer, but do they actually know that alcohol causes cancer?
So I think, first of all, it's important actually to mention that cancer is now the leading cause of death in Ireland. So 30% of deaths in Ireland every year, or almost 1 in 3, are as a result of cancer. And we've actually known for a very long time that alcohol causes cancer. So alcohol was first classified as a Group 1 carcinogen by IARC, which is the International Agency for Research on Cancer, in 1988. So that's actually nearly 40 years ago now. So if something is a Group 1 carcinogen, that means that we have enough evidence to show that it definitely causes cancer in humans. So to put that into perspective, other substances in the same group include things like tobacco and asbestos. And in 2023, the WHO actually declared that there is no safe level of alcohol consumption and the cancer risk increases even with low levels of alcohol consumption. But we know that, in fact, the levels of awareness of this risk amongst the public are actually still very low. So, for example, a recent study that was carried out by the HSE's National Cancer Control Programme found that less than half of those surveyed were aware that alcohol is a risk factor for cancer.
Okay. And Sheila, then when we talk about communication challenges that we're facing when we're implementing these things and implementing this new labelling, what do you see the challenges going forward for that?
Well, the label itself is relatively straightforward, and producers have been given plenty of notice. They've had a 3-year lead-in time from the passage of the legislation to actually doing that. So it's actually not difficult to implement it. And what's probably important is that the public understand, why that this is being brought in. Because at the moment, if you think about it really, the alcohol industry is our primary educator, in inverted commas, of alcohol. Is the place where we get what we think of as information about alcohol. Actually, what we get are myths about alcohol. And, the industry regard the packaging of their product as integral to their marketing of the product. You know that yourself, like when you look at labels of any product, they're designed to appeal to particular cohorts for different reasons. So the industry certainly are vociferous in their complaints about this legislation coming in.
Was there a lot of pushback from the industry in relation to this?
Yes, there has been. And, it's very interesting actually. There's been some analysis actually done on looking at the arguments that the industry have put forward. So among other things, it's been, it'll be a barrier to trade. And that's a frequent one that's used. That's actually just quite simply not the case because, as you can see, different countries, for example, France, has a pregnancy warning label. They're required to have that. So the industry are well able to be able to manage different labels for different markets. The second argument that's used is it surely couldn't be true. I mean, it's not true. I mean, they literally have said this, that it is not true that the label is factual. They say that very particularly in relation to the cancer warning. And they try to, I would say, put in a complexity argument. Oh, cancer's terribly complicated. Liquor, couldn't really be really that at that. Or it's only very high levels of alcohol usage that might lead to a problem with cancer. But that's simply not the case. Alcohol, even in low levels, 1 to 2 drinks a day, has been shown to increase the risk of cancer. And the pathways are clear and have been laid out. But that's the type of argument that is being used. And that is designed to put doubt into people's head and they hear things like that, which goes back to why it's actually so important to have labels, to have clear labels coming from trusted public health source to give that information, not to be relying upon an industry with a vested interest,
Yeah. And Breeda, so we know that alcohol can cause cancer. What types of cancer are we talking about?
So alcohol causes at least 7 types of cancer. So I suppose if you think about, first of all, the tissues that are coming into direct contact with alcohol, so increases your risk of cancers of the mouth, the pharynx or the throat, the larynx or the voice box, and also the esophagus or the food pipe. And it also increases your risk of bowel cancer. The liver processes most of the alcohol that we take into our bodies. So alcohol also increases your risk of liver cancer. And alcohol alters the levels of certain hormones in our body, for example, estrogen and insulin. So as a result of that alteration of estrogen levels in your body, alcohol also increases the risk of developing breast cancer amongst women.
If you reduce your alcohol intake, is that significant in preventing cancer? And things like breast cancer, liver cancer, colorectal cancer, does it help with reducing the risks there?
Yeah, so absolutely. So I suppose, as we've mentioned already, any amount of alcohol consumption increases your risk. But the good news is that the less you drink, the lower your risk. And alcohol is one of the leading risk factors for cancer in Ireland. So, for example, in 2020, it's estimated that around 1,000 cases of cancer were attributable to or caused by alcohol. So it causes over 260 breast cancers a year in Ireland and over 320 bowel cancers. It causes a third of cancers of the mouth and the upper throat. It causes 1 in 4 or a quarter of cancers of the larynx or the voice box. And it causes 1 in 5 cancers of the esophagus.
Okay, so Sheila, Breeda's just mentioned alcohol and cancer there, but we know that alcohol causes lots of other harms. This is all about increasing public awareness. What other harms would you like to tell our listeners about?
Well, we already know there's a very clear risk to heart disease from alcohol. And again, that would be one where the industry are love to say things like, oh, red wine is good for the heart. That is quite simply not the case. and the World Federation on the Heart has made that definitively clear. So that, again, that kind of trying to destroy the myths that would be around that. So we know that deaths from alcohol, about 2/3 of them would be falling into those diseases like liver disease, like cancer, like heart disease. But then about 1/3 of deaths actually arise from what you might call incident. So there are things like falls and, very sadly, suicide that would be there as well. So those are kind of the big known kind of things.
Yeah.
But there's a multitude of lots of other harms. There's certainly the impact on your mental health and your overall well-being. Many person will say to you, it was hard to get up on a Saturday morning or a Sunday morning to go and get the children to the sports or whatever, simply because of the effects of the night before. And that might seem like not really a huge thing, but it builds up. And, the more alcohol that's in your system, the harder it is simply to get going. We see impacts on the sleep, and a lot of people talk about interrupted sleep and, maybe aren't always aware that actually alcohol can be one of the things that causes that sleep disruption. And that's, I think, where the likes of the Ask About Alcohol website is so incredibly important, because there's this multitude of different impacts and harms that come from alcohol. It's also obviously a component in terms of obesity and weight gain. It's one of the things I'm very pleased about actually to see on the labels is that we will have the calorie value of the product, because unlike every other product that you can buy in the EU, every other product is required to give you a list of its ingredients and also its calorie values. Even your bottle of Ballygowan that's sitting there on the table has to say what is the energy value. The one product that doesn't have to do that is alcohol. But this new labelling regulations will give you that information. And I think that's an important thing when people maybe are thinking about their calorie intake, the weights that might be there, simply to have those facts at hand.
Yeah. Breeda, just going back to you again, Sheila said earlier on that the industry says, cancer is a very complex thing. But can we definitively say that alcohol causes those cancers that you've just mentioned?
So the short answer to that is yes. I think to understand how alcohol causes cancer, it's useful to first think about what cancer is really. So the cells in our bodies, they're constantly growing and dividing and dying and being replaced in a controlled way. And sometimes things that we're exposed to can cause damage to the DNA or the genetic material in our cells. So often our bodies can repair this damage, but sometimes they can't. And cancer is when these abnormal cells grow and divide in an uncontrolled way. So alcohol contributes to that process a number of ways. So when we drink alcohol, our bodies turn it into a chemical called acetaldehyde, and this causes damages to our cells and can prevent them from repairing damage. As I mentioned earlier, alcohol also increases the levels of some hormones in our body, for example, estrogen and insulin, and higher levels of these hormones can cause cells to divide more quickly. Alcohol also impairs the body's ability to absorb nutrients, which may protect us from cancer. And again, as I alluded to earlier, particularly the tissues that come into direct contact with the alcohol, so in the mouth and the throat and so on, alcohol is a really good solvent. So what the alcohol does is it makes it easier for cells to absorb harmful chemicals. So for example, alcohol can improve the absorption of toxic chemicals from cigarette smoke. And I think that's really a point worth mentioning, because what you find is that a lot of people that don't even consider themselves to really be smokers will smoke when they're having a drink.
Yeah. So we can definitively say that alcohol does cause cancer.
Yeah.
That's a really important message for the public. The other thing that I've been noticing, and maybe it's just in the media or in the newspapers or whatever, about liver disease, and liver disease affecting younger people and particularly women, Sheila. And I think there was a Panorama programme about this, and I was really shocked by that.
Yeah, so unfortunately there have been a really sharp rise in the level of liver disease amongst younger people and indeed amongst younger women. And in a way that's not surprising, because there has been a big increase in the level of alcohol that women are drinking. And why is that? That's because the industry has used and has turned its marketing focus directly onto women. So it used to be 20 odd years, 30 years ago, men drank about 2/3 of the alcohol that's consumed in Ireland, and women drank about 1/3 of it. And so the industry kind of saw, my goodness, there's a market there, there's something to be looked at, and really directly moved their marketing strategies to target women. And there's work that's going on actually in Glasgow in Scotland. Professor Carol Emsley has kind of looked at this and really investigated that type of thing. You would know it yourself. You see the types of alcohol, literally pinkifying, pink gin. You see it in cocktails. You see cocktails being dressed up in ways that are there to appeal more to a female audience. So fruity kind of flavours, concoctions, lots of herbs and things being added in. Almost looks like a health drink these days. That's very deliberate. And you see it also in things like using a tag of empowerment. you too can drink in this way. But there is a basic reality that, women's physiology is different from men. So the same amount of alcohol will actually affect women in a way that is particularly harmful. While we still have the bulk of the harms from alcohol probably occurring in the male population, we are seeing this increase in liver disease in women. And it reflects, I suppose, as well, people do not have to be addicted to alcohol to experience harm from alcohol. And I think, and that program that you were talking about was very good on that, because really what the contributors were saying was they were drinking what they felt normally. They were drinking as they would see, the majority of the people around them were drinking. And here in Ireland, we, for example, would have very high levels of binge drinking. So about 28% of the population would binge drink on a regular basis. We're the 8th highest across the OECD in relation to binge drinking. So that's, consuming a lot of alcohol on one particular drinking occasion, so more than 6 drinks at a time. And it's that kind of drinking that has particular risks that go along with it, of which liver disease is one of them.
Yeah, it's a stark increase, really, isn't it? In relation to liver disease.
Yeah, so certainly in the last 2 decades, there's been an 80% increase in alcohol-related liver disease in Ireland. And in fact, actually, if you were to go back, further than that, measuring from, say 3 decades ago, it's more like 200% an increase. So we're seeing the working through of the increased levels of alcohol consumption across the population. And again, I would always be thinking of this. This is a very deliberate tactic of an industry to focus on people who weren't drinking as much to get them to drink more.
Yeah. And that's a huge public health concern, I'm sure. What would be the messages, Breeda, to our listeners in relation to alcohol consumption?
Well, I suppose the key thing is, I mentioned a study that, we carried out in NCCP earlier, whereby there were low levels of awareness amongst the general population about the link between alcohol consumption and cancer. But an additional finding of that study was amongst those people who were aware that there was a link between alcohol and cancer, more than half of them were under the impression that in order to be at risk of developing cancer as a result of your alcohol consumption, you had to be drinking an awful lot for a very long time. The key message here is that there is no safe level of alcohol consumption. The more you drink, and the higher number of years that you drink, the higher your risk. And I suppose conversely, the positive side of that message is the less you drink, the lower your risk.
Okay, so that's pretty straightforward, isn't it? And Sheila, despite clear risks, and maybe we don't have the public informed enough about it, people continue to drink, and we constantly have to get this message across. And I think with all of the different things that are happening, it's like a package of information that we're giving the public over the last few years and into the future.
So I think package is exactly the right word. The WHO is very clear on what are the population-wide measures that you can take that will work. And they're controls on price, marketing and availability. I'm always very conscious when we're talking about the marketing. Like here in Ireland, we would see something of the order of about 115 million euros worth of alcohol advertisements every year. That's not counting even sponsorship, sports sponsorship and the deals that would go with that. These are just the ads that you see on TV. It's very difficult for the HSE or any other health body to come up with 115 million euros worth of health information advertising that can counter that. But there are things that can be done. We would say first and foremost, we need to reduce the amount of alcohol advertising that we're seeing. We have some modest measures within the Public Health Alcohol Act, which is really, really welcome. So, for example, from January 2025, we'll have the broadcast watershed coming into effect. So you won't be able to see alcohol advertising before 9 p.m. So that'll reduce to some extent the amount of ads that we see. And that's a good thing. But we are increasingly seeing the amount of internet advertising that's happening. These are even more insidious because they're very targeted and directed. Like the alcohol ads that I might see as a woman in her 50s is going to be different from the alcohol ads that my daughter in her 20s might see. So we really need to be on top of those policy measures that actually really look at these things carefully. And I think look about the protection of our population. But what people working in health, I think, though, can do is to raise it with patients, with people that they're coming in contact in their professional lives. Because I often think, when you go into your doctor or you meet a nurse or you're there, you're talking to a healthcare professional because you've got a concern about your health. And people tend to be very open to messages at that particular time. So I'd really encourage, healthcare professionals, who are trusted, very, very much trusted people in Ireland, to feel comfortable in bringing up issues around alcohol. Simply asking the question, how much are you drinking? Are you aware of particular risks that would be there? And sometimes I know individuals can feel uncomfortable about doing that because they're perhaps thinking that, oh my God, is somebody going to be looking at my drinking and what I do? And, bear in mind, 73% of the population drink. smaller number, only about 17, 18% would smoke. So the likelihood is that a healthcare professional is drinking or has drunk in the past and can feel just maybe uncomfortable with that. And I'm always saying, just set aside your own feelings, because it's not about you. This is about people in front of you who are seeking help, seeking information, and want at this point to find out something that's maybe going to help with their own health.
Yeah. So, Breeda, the alcohol industry often focuses on the social and fun aspects of drinking. Is there any benefits to drinking at all?
So I suppose, as Sheila mentioned earlier, many people are familiar with this concept that drinking a small amount of alcohol may be good for you, or this idea that a glass of wine is good for your heart. And there were a number of studies carried out that did initially appear to show this, but there are a number of potential problems with those studies. So, for example, many of the people that were classed as non-drinkers in those studies would have given up alcohol due to suffering alcohol-related harm or other types of ill health. So they're actually unhealthy as a result of those previous pre-existing health conditions, as opposed to the fact that they're non-drinkers. And I suppose more importantly, even if there were to be a benefit in terms of your heart, it's significantly outweighed by the cancer risk and the other health risks associated with alcohol. So the bottom line is that drinking any amount of alcohol increases your cancer risk and your risk of other health problems, and it's not beneficial to your overall health.
Okay. And just going back to the whole thing about the calories that are included in alcohol, in all of the alcohols feed on the label, what do you think the benefits to that will be?
So I think calorie content is a really key element of the labelling, because at present alcohol is probably unique in that I certainly can't think of any other food or drink product that doesn't have calorie content on the label at present. And alcohol is actually extremely high in calories. So a gram of alcohol contains 7 calories, and only fat, which contains 9 calories per gram, has a higher calorie content than alcohol. And also there are a lot of other ingredients in alcoholic beverages, for example, sugar, that also contribute to the calorie content. So alcohol is a really high energy calorific food substance or drink, and provides you with empty calories. You're getting those calories of their energy, but you're not actually getting any nutrition. So I think a lot of people are inadvertently drinking an awful lot of calories that they're not aware of. So I think improving awareness of the calorie content will be really beneficial in terms of public health.
And it's all about increasing public awareness. And Sheila, what about this light drinks? Or then we can talk about 0.0 as well. I mean, I'm sure that you can explain to us a little bit about that and the benefits of it or the harms of it as well. So what do you think about this whole light?
Yeah, well, there's actually an interesting thing, because there's a lot of products that are marketed using the word light. You'll see certain brands and they say, name the brand, light, something light. But that's actually not defined in any kind of way at all. And when you look more carefully at them, you kind of go, well, are they light in calories? No, they're not. Are they light in alcohol? No, they're not. So
there isn't less alcohol in them?
No, it's quite surprising, but no, they tend not to be. They're there as a marketing tool. They're there just to describe your product in a particular way, to give you a sense that they are somehow better for you than another product, which again goes back to the whole reason why it's so important to have unbiased information actually being provided on the label. In relation to, zero alcohol products, well, that's a choice and people have whether they want to drink them or not. It's not really clear whether in fact actually there's a growth in this particular market. So they make up about 2% of the market. It's not clear whether that growth is coming from not drinking alcohol, or is it a change, say, from drinking a soft drink when somebody might be out. Our concern really with zero alcohol products is not so much the product itself, but it's more to do with the marketing of them. Because going back to that legislation that I mentioned, the Public Health Alcohol Act, it lays down particular areas where you can't advertise. And that's really with the view towards protecting children. So it's things like not advertising close to schools, for example. These are products that are not suitable for children. Even the alcohol industry themselves say that they're apparently not, meant for children. And yet, why would you advertise then close to a school? So we would say that certainly the industry is using a bit of a workaround or trying to get around that. So I would describe that as a cynical kind of a approach to it. But going back to the basics, it's important to have the information, what's in the product, what's not in the product. And at least the labelling that we'll have, as Breeda was saying, will give you that bit of extra information, certainly about the calories that's there. And I think that helps us all to make informed choices.
And Breeda, the word that Sheila used there that kind of stuck with me was about the importance of the labelling is unbiased. It's unbiased information. It's truthful information. It's straight up what exactly is in the product, what the risks are. And if you wanted to give our listeners one message, what would be the message from you from public health?
Yeah, so I think a really important takeaway is that there's no safe level of drinking, and you can experience alcohol-related harm even at low levels. But having said that, I think there's a really positive message here. Cutting down on your drinking has huge benefits for your physical and mental health and your general well-being. So in addition to reducing your risk of cancer and other health problems in the long term, the ones that we've discussed earlier, if you reduce your alcohol intake, you'll experience immediate benefits. So you'll look better, you'll have better skin, you'll have better hair, you're likely to lose weight, you'll feel better, you'll get better sleep, you'll have more energy, your mood will improve, you'll be less anxious. If you play sports, your performance will improve, you'll have better relationships with people, you'll have more time, and you'll save money. And I think if there was a pill on the market that could do all of those things, people would be queuing up for it.
Absolutely. When you list out all of those things and all the benefits, it's huge, like really.
And those are immediate benefits.
Yeah.
You know, that's what will happen tomorrow if you reduce your alcohol today. And then in addition, you have the long-term benefits in terms of your reduced risk of cancer and other chronic diseases.
Yeah, absolutely. And Sheila, over to you. What would be kind of your message to the public or to our listeners?
Well, I suppose our work is usually around policy work. So I'm usually trying to talk to a government or trying to look at that. And I suppose the thing that I would really love to see with a new government coming in is, you know, trying to look at alcohol in the round and look at it in all the different aspects of it. So whether we're talking here primarily about health, obviously, but we see the impacts on workplace productivity. 1 in 7 workers are impacted by a colleague's drinking. That was a very good survey done a couple of years back ago by the HSE. When you have that level of disruption in a workplace, that has impacts on the bottom line of any business. So I think it's important that we see alcohol in many different areas. Could be crime, could be productivity, can be health. And I think we should have a coherent view of it, so that we look on it as a product that's actually costing the state 2.5% of its GDP, that's of the order of 12 billion, and really try to see what could we be doing, what are the policy measures and the coherent policy measures across government that would make a difference there. So we have a Department of Health who's actually seeking to reduce our alcohol consumption, but then we can have other departments, for example, the Department of Justice look after licensing, and there have been proposals from there to actually extend licensing hours. And that's, we would say, is a risky thing, because the longer the opening hours, the more alcohol is sold, the greater the consumption and therefore the greater the harms. So we need to have a coherent view. We're moving towards that, say, with gambling. So we have a gambling regulation authority which looks after licensing and the pricing that would go with it, and indeed the controls and the marketing of it. And I think there's a need for something similar with alcohol.
Okay. And Breeda, I know I said one last thing, but I also, just when Sheila mentions it there, I want to talk to you about the extended opening hours. And from a public health point of view, what do you think about that one?
Yeah, so just to reiterate what Sheila has said, really, like, I would absolutely not like to see the proposed legislation to extend the opening hours being introduced. So first of all, you have the implications for public health in terms of cancer risk and chronic disease and so on. But in addition to that, the international evidence is actually overwhelming that even a 1 hour extension is associated with a 17% increase in alcohol-related crime, up to a 30% increase in road collisions, and a 34% increase in alcohol-related injuries requiring hospital treatment.
Yeah, they're stark numbers. So that's the end of our HSE Talking Health and Wellbeing podcast for today. I'd like to thank Dr. Breeda Neville, Specialist for Public Health, and Dr. Sheila Gilheany, CEO of Alcohol Action Ireland. They really gave us some invaluable insights into Ireland's new alcohol labelling laws and the broader public health issues around alcohol use. From the connection between alcohol and cancer to the cultural and economic challenges of reducing consumption in today's world, who may appreciate the advice and information in it. If you'd like more information about HSE Health and Wellbeing, follow us on X, LinkedIn, take a look at our HSE YouTube channel, or register with our easing by emailing healthandwellbeingcommunications@hse.ie. Thank you for listening.